Hey, what's going on? And welcome back to another video. If you are new here, welcome. It's your girl, Naiah Nikole. So what do you call a post-op transgender's hoo-ha? A sheenus, mangina, manhole, or vagina? Well, whatever you might call it, I call mine magical custom-made vagina. And today, I am going to be talking to you about the whole process that I went through to go from a penis to a full functioning vagina. If you are planning on getting surgery or you are curious about the whole SRS process, stay tuned. So I want to start by talking about how I came to the decision of getting surgery. Transition is, or at least in my opinion, I believe that should be a long, methodical step-by-step process. Whether you decide to take hormones, get breast augmentation, get FFS, facial feminization surgery, to those of you who don't know what FFS is, or body contouring, it should all be a step-by-step process which you grow into your decisions and the outcomes, disadvantages of every decision that you make. It took me a long time to come to the conclusion of getting the surgery. I didn't just wake up one day and had all the resources needed to get the surgery like most people. I had a lot of time to think about getting surgery. Now, in today's world, it seems like it's easier to get surgery more than ever. So here's my advice. I always wanted to get the surgery, even though I enjoyed the sexual pleasures that I had when, I had my male parts. I couldn't imagine living one more day with it. I just wanted to be flat down there, to be honest. Having my male parts just disgusted me beyond reason. My gender dysphoria was really, really bad. What I contemplated the most was, what if it goes wrong and it looks horrible? I lose all sensation. I could never have pleasurable sex again. That's what I would warn anyone to think about. My decision was easy though. I was willing to trade all of that just to wake up and not deal with the painful dingle-dangle of tucking and also looking at myself in the mirror naked. I couldn't bear it. I made up my mind after seeking help from a psychologist who I would regularly see to deal with my constant battle of not allowing myself to fall into depression because of my male genitalia. Who did I choose as my doctor and why? After so much research, I decided to go with worldwide renowned surgeon, Dr. Chatawat in Bangkok, Thailand. There are about 5 types of vaginoplasty procedures out there. He uses the scrotal skin graft technique to get better depth, which was important for me. Most other doctors use like the whole penile inversion technique, which makes for a very shallow vagina. It brings other issues. So be careful. Do your research. Prior to choosing a doctor, make sure to know what it is that you want as a result of your surgery. I date men, and my goal was to be able to have penetrative sex as my SRS outcome. Dr. Chatawat aesthetically makes porn star looking vaginas. I swear. I wish I could show you mine, but I'll probably get banned. For those of you thinking of getting surgery, you think that it's easy to just contact a doctor, pay, then get your surgery. Listen up. When I contacted the doctor, they sent me like a list of requirements. One of the primary requirements that was all the documentation needed to get the surgery. At that time, it was 2 letters from medical professionals, one from a psychologist and another from a psychiatrist. I already had letters of clearance because I had been seeing a psychologist, like I said before, during my transition. I recommend having a trusted team of doctors helping you through your transition to avoid making mistakes along the way. We've all seen the people who come out and say, oh, we're not trans, and decided to detransition, now have irreversible scarring or worse for the decisions that they made. And honestly, they cannot blame anyone else but themselves. Take your time transitioning. It is not a race. I had my letters, I booked my appointment, which felt like months of eternity in the future. I was ordered to stop hormones 2 weeks before surgery. I wasn't really taking hormones in the first place, so that was easy. Also, you have to do some blood work prior to scheduling just to make sure that you're healthy for surgery. You're wondering about costs? Well, the total cost was about $20,000. Damn, I could have used that as a house down payment. I know. So here's the breakdown. Cost of surgery was $12.5 thousand. Hotel was $3,000. I stayed at their recommended place. It was the Doucette Princess. It was really, really nice. The room was super modern. All the meals were included. They had a resort type of pool, which I loved. There's a huge mall, like literally like walking distance from the hotel. So it was perfect. The flights were 3K, 23 hours long, and 2 connections later. If I had to do it over, I would have flown first class on the way back though. Biggest recommendations, I would say almost mandatory must is to take someone with you. This whole surgical process is very hard emotionally and physically. You need all the support you can get. Also, get travel insurance. You never know what could happen. And if you get travel insurance, it could pay for anything that could go wrong. Make sure you bring your laptop bring your laptop with a VPN so you can watch your favorite TV shows. Trust me, you're gonna need the distraction. Also, what to pack. All your documentation. Literally, like all of it. Name changes, everything. Like everything you have. You might not need it. You don't want anything to stop you like on this journey. I keep a folder, like a regular binder with all my documents to keep everything organized. It really helped. As far as clothing goes, pack loose-fitting pullover granny dresses, serious, that you don't care about because you will not be wearing it anywhere but your hotel. Also, bring full-size panties, no thongs, ladies, even though you might want to wear those. Nothing expensive because you're gonna bleed on it post-surgery. Your toiletries, you won't need anything fancy. Once you arrive in Bangkok, make sure you hire a legitimate ride from the airport to your hotel. You don't want to get kidnapped or robbed by a fake cab driver, so be careful. I flew in before I needed to be there to get all settled in. They required you to be there like, I think 3 days in advance. You will have a consultation before surgery with the doctor, and then you'll fill out all the medical forms just like you would in regular medical office. You're gonna talk to him about everything. I mean, make sure to tell your doctor what you expect and what things are like most important to you. So when you go into the surgery, he can focus on giving you the best outcome. After the consultation with him, the most uncomfortable part is having to get photographed, like down there. As a trans girl, I was mortified. I am guessing it's for like before and afters. All I was thinking at that point was like, ugh, whatever you gotta do, doctor, but just give me that pussy. Oh my God. It literally just dawned on me. What if he's still using my before and after pictures to show you girls now that are getting surgery? Oh my gosh. Anyway, now the hard part begins. You have to get on a liquid diet 3 to 4 days prior to surgery. You take these like pill laxatives that they give you and an enema 2 days before surgery. So you're completely clean down there and you're ready for surgery. Maybe because they don't want you to like take a on their bed or something. I don't know. Like while you're getting surgery, maybe that happens. I don't know. Now let me be the first to tell you that you will be peeing out of your freaking ass like never before. One thing is you're gonna feel scanty. It's surgery day. You can ask to get a Valium to relax the day of surgery. It's up to you. You get into your gown, you enter a room, you lay on this freaking crucifixion looking ass bed. No joke, it's crazy. Crazy ass looking bed. This is where you're gonna start panicking. Don't worry, my little darlings. The anesthetic is coming soon. Once they strap you down, and you're awake. They put you to sleep just like any other surgery. If you've never had surgery before, basically it just feels like your body really, really heavy, and then everything goes black. When you wake up, you are in a totally different room. If I remember correctly, you're in the hospital bed for like 3 days. To give you a great visual, you pretty much just wake up in a super cold room. You have a big freaking diaper. You feel nauseous from all the anesthesia. I threw up like 3 times after waking up from surgery. You're kept on a clear liquid diet that day, and then they give you pills to help with sleep and pain. Sleeping for me was the most uncomfortable because I hate sleeping on my back. Like, you're literally laying there and you have this diaper thing with like a catheter coming out of there, and then like drains and all this stuff, and oh my God. The day after surgery, the nurse will give you a sponge bath. The staff is super amazing for that. They give you a freaking epidural. Basically like the same kind that they give women when they give birth. I think they give you like more than that because it doesn't seem to wear off the same day. Day 3 rolls around after surgery. It's time to get your first steps as an official female. The main goal of like walking around is to like prevent vein thrombosis. Basically, it's to prevent blood clots from forming in your legs so you don't die. At this moment, this was like such an emotional moment for me personally. I felt like I had conquered my transition. Everything male was left behind. Another thing that happens on day 3 is the drains that I was talking about. They come out. That process is a bit painful and scary. It's one more step towards healing, so like whatever. If you are not ready to leave, also because they kick you out after the 3rd day, by the way, you can pay extra money to stay like extra 2 days there in the hospital when they're taking care of you. You'll have the catheter in there still. That's just to keep the wound sterile, and since you haven't been eating anything for the past few days and stuff, you won't even need to take a or nothing. They send you to your hotel with like a surgery care package that includes gloves, lubricant, pads, 4 dilators. Check these out. I got 4 of them. They're made out of like hard, I don't know, plastic? I don't know what I would call this. They have like a measuring thing right here, like a measuring ruler. It says how many inches, like if you stick at the furthest you stick it, and it'll say like, 4, 5, 6, 7, and 8 inches. Yeah, that's the dilators they give you. I'll tell you why in a little bit. So for the following week, a nurse will come to your hotel and help you change your dressings. I believe 5 days after surgery, she removes all the dressings completely. Literally, it looks like a freaking magic trick. Like she's pulling all this gauze from your pussy, like when the clown pulls all the colorful tissue from his pocket and it just keeps going and going and going. That's basically what it looks like. You get to see your vagina at this point, and it looks like the whole football team ran a train on you. It is very hard to believe at this point that your vagina is ever going to be pretty. Don't worry, pretty kitty coming soon. Trust the process. Remember these? Now that your packing is out, the nurse shows you how to dilate. Yes, bitch. You have to dilate that open wound, and it is gross and painful. You basically start using like the smallest, graduating to the biggest 3 times a day for 50 minutes each session. You are free to go home after 2 weeks post-surgery. You will have 1 last doctor appointment before you go home. The doctor will give you like some aftercare instructions and how to clean your new vagina. We'll just tell you to keep your dilation schedule going. After about a month and a half, you stop bleeding. You are still healing internally. I wore like these little mini pads that girls wear when they're like getting off their period, like towards the end of they're like panty liners for like 2 months for my panties not to get any blood on them. During this whole healing process, I really related to women and their periods. Gross, can live without. I'm sorry, ladies. The dilating sessions get less and less after a year. You can do it like once a day, and then it goes to once a month forever and ever and ever. The doctor tells you at like a 3-month mark, you can have sex, take baths, and go to the beach. So basically everything's like normal. I, of course, after not bleeding anymore, I was so ready to explore my vagina. If you want to hear all about how I explored my vagina and my sex experience with guys, watch my video, How to Have Sex with a Transgender Woman. I want to hear from you guys. What did you think about the SRS process? Is there anything that I missed that you still want answers to? Well, let me know in the comments. If you have enjoyed this video, please give it a thumbs up. If you want to see more content like this, make sure to subscribe and to turn on your notifications. Thank you guys so much for watching, and see you guys next time.